Good evening, everyone. Today we are going to discuss the topic Hinge access and the Facebook. So before starting with the topic, we have to understand what is the purpose of using a Facebook and what is the importance of Hinge access in our prosthodontics. So when we are planning a full mouth rehabilitation cases or those cases when we have to change the vertical dimension, and also when we are giving a balanced complete denture cases, we have to accurately or arbitrarily we have to locate the hinge axis and we have to transfer it to an articulator using a Facebook. Only then we will be able to achieve a proper occlusion both in the eccentric and during eccentric and eccentric movements. So hinge axis means it is a imaginary line passing through the two mandibular condyles around which the mandible rotates. So this is our mandible. So when the mandible is opening and closing, just imagine a line between the two condyles. That is a hinge axis. So when there is a pure rotation of the mandible, when opening and closing movement is there, when there is a pure rotation without any translation, this pure rotation part is called, it is a terminal hinge axis position. So uh, this hinge axis we have to locate accurately and we have to transfer it before programming the or in order to program the articulator. So when we are fabricating complete denture cases or we have three types of jaw relation. One is the orientation jaw relation, then is a vertical jaw relation and horizontal jaw relation. So orientation jaw relation means this maxilla or the maxillary plane has to be oriented with the relation to the cranium. Only then we will be able to establish the relationship between the maxilla and mandible properly. So uh, they are grouped as such because the relationship of the mandible to the maxilla is in the three dimensions of space, that is sagittal, vertical, and horizontal planes. In the orientation relation, they are those that orient the mandible to the cranium in such a way that when the mandible is kept in its most posterior position, the mandible can rotate in sagittal plane around an imaginary transverse axis passing through or near the condyle. So this is what we are doing. Orientation jaw relation means this is what we are orienting the maxillary cast to the cranium or we are trying to locate the hinge axis. The axis can be located when the mandible is in most posterior position. That even it is in centric relation position. So Facebook, this is the image of a Facebook which is used. So what are the landmarks required for recording the Facebook or positioning the Facebook that we will see? So positioning the maxillary cast in an articulator is an essential part of many techniques in dentistry. Two major objectives are restoration of teeth in occlusion and control of the form and position of the teeth. The maxillary cast in the articulator is the baseline from which the all occlusal relationship starts, and it should be positioned in space by identifying 3 points which cannot be on the same line. So in order to align any three-dimensional object in space, we need 3 points. So 3 points here, what we are taking is one anterior point and two posterior points. So we have one anterior reference point and two posterior reference point in order to um, uh, transfer the position of the maxilla to the articulator. The 2 points are located in the area of the temporomandibular joint, and the third point is selected anterior to the TMJ. That is, posterior is the TMJ, anterior to the TMJ. The third point is selected and this will define a plane of reference which is oriented in the articulator so that the three-dimensional position of the maxillary cast is reproduced as it is in the patient. So here, what is a Facebook? So the definition of Facebook says that Facebook is a caliper-like instrument used to record the spatial relationship of the maxillary arch to some anatomical reference point or points and then transfer this relationship to an articulator. It orients the dental cast in the same relationship with the opening axis of the articulator. So we know that patient is having an opening and closing axis. So arbitrarily, when we are changing this position to an non-adjustable articulator, there is a mild change in the opening and closing axis of the articulator. So using a face bow, when we are locating the hinge axis arbitrarily and when we mount the cast in the semi-adjustable articulator, so using a face bow, when we transfer it, we will be able to achieve the same opening and closing axis of the patient to the articulator. So whatever changes we are making in the articulator and we'll be able to see the same changes has been made in or we'll be able to use the processes or to fabricate the process without any much changes. What are the parts of a Facebook? So for Facebook is having a metallic frame, and there is a bite fork, and there are two earplugs, which is this is a Hanauf Facebook, Hanauf spring bow. Here we are using, sorry, here what we are using is uh, orbital indicator as a anterior reference point. So according to the articulator, what we are using, some articulators are using, or some Facebook they are using anterior reference points as Nasion, and some other reference points are there. One is the orbital and Nasion minus 43 mm. These are some anterior reference points. So in this reference, in this articulator, in the Hanau phase, uh, Hanau wide view articulator, this spring bow phase bow is used. So it is having a U-shaped frame or assembly that is large enough to extend from the region of the temporomandibular joint to a position 2 to 3 inches in front of the face and wide enough to avoid contact with the sides of the face. Condylar rods that contact the skin over the temporomandibular joint. Condylar rods that contact the skin over the temporomandibular joint. So in this also we have some types of some types of Facebook. Some are using ear rods, some are using condylar rods, and we have fork which can be attached to the occlusal rim, and the fork for the Facebook attaches to the Facebook by means of a locking device. Hinge axis. When the mandible opens and closes, rotation occurs around a transverse axis, which is more commonly called as hinge axis. Then what is terminal hinge axis? This hinge axis is called terminal hinge axis, or the axis is called terminal hinge axis when the mandible undergoes rotation while in centric relation position. So according to GPT, an imaginary line around which the mandible may rotate within the sagittal plane. So maximum range of terminal hinge rotation averages about 12 degrees and creates a range of 18 to 25 mm of interincisal opening. So up to 18 to 25 mm of interincisal opening, there is a pure rotation. And above that, there is a translation of the condyle which is happening. So when there is a pure rotation of the condyle, it means that it is in the terminal hinge axis position. What are the types of Facebook? So previously I told you we have some Facebook having condylar rods, some Facebooks are having earpiece rods. So in this how types of Facebook, we have arbitrary Facebooks and kinematic Facebooks. So in arbitrary Facebook, they are locating the hinge axis arbitrarily. So according to some articles, they say is that when we are locating hinge axis using arbitrary Facebook, they will be able to locate the hinge axis within 5 mm radius of the true hinge axis. So it will not have much changes. There is a minor error of about 0.2 mm in the second molar region. That is what author says. So in complete danger cases where we need a full mouth, where we need a balanced occlusion cases and all, we are using a arbitrary Facebook. We are not using kinematic Facebooks. So in arbitrary Facebooks itself, we have earpiece type and fascia type Facebooks. So earpiece type, as the name suggests, earpieces will be used to orient the or to find the posterior reference points. In the fascia type, they are taking condylar rods anterior to the TMJ for locating the posterior reference points. Although the kinematic phasebow is more accurate, the far less complicated arbitrary phasebow is considered sufficiently accurate for routine laboratory work. Then why it is sufficient means for complete danger cases, there is some amount of resiliency for the mucosa. So this I told you, when we are locating hinge axis arbitrarily, it is causing some error. So that error is about 0.2 mm difference in the posterior region. So that error will be compensated because of the resilience of the mucosa. So because of that reason, they're telling it is sufficient enough to use an arbitrary phasebow for routine laboratory work procedures. The need for better and less intricate device has led to the development of new generation phasebows. The main innovations are the use of external auditory meatus to represent the hinge axis and the condyles, the development of self-centered bows, the development of superior and more reliable fork devices. So these are some parts of the Facebook which is getting advanced. Arbitrary Facebook. They use arbitrary or approximate points on the face as posterior reference points. The condyle rods are positioned on these predetermined points during the Facebook transfer procedure. Arbitrary Facebook are most commonly used for complete denture patients. These placement of this placement of condyle rods will generally locate the opening axis within 5 mm of the true center of the opening axis of the jaws. Fascia type utilizes approximate points on the skin over the temporomandibular joint region as posterior reference points. These points are located by measuring from certain anatomical landmarks on the face. Earpiece type. It was first discovered by Dalby in 1914. This type of Facebook uses the external auditory meatus as the arbitrary posterior reference points. For this, a special earpiece is required instead of a condyle rod. The external auditory meatus is assumed to have a fixed relationship to the hinge axis. Commonly used types of Facebook. Snow Facebook. I told you, according to the articulator what they are using, the Facebook also will change. So this is the Snow Facebook. Second one is the Artist 3D Facebook. Third one is the Springbow, which is used for now wide view articulator. Quick mount Facebook is for Webmix articulators. Webmix quick mount. DNR Slidomatic Facebook. These are the different types of Facebooks which are used for different semi-adjustable articulators. Plane of orientation. The maxillary cast in the articulator is the baseline from which all occlusal relationships start, and it should be positioned in space by identifying 3 points. The plane is formed by 2 points located posterior to the maxillae and 1 point located anterior to it. So whenever we want to transfer using Facebook, we have to locate 3 points, 2 posteriorly and 1 anteriorly. Posterior points are referred to as the posterior points of reference, and the anterior one is known as the anterior points of reference. Posterior points of reference. The position of the terminal hinge axis on either side of the face is generally taken as posterior reference points. Prior to aligning the Facebook on the face, the posterior reference points must be located and marked. They are located by arbitrary method and the kinematic method. Often, the posterior points are located by measuring prescribed distance from skin surface landmarks. Some of the commonly used posterior reference points were shown by Beck to be near the hinge axis clinically. He concluded that Bergstrom point most frequently is closest to the hinge axis.